Good morning, everybody. Today we're going to be talking about using fillers for nose augmentation. And, with the fillers, I think it's really a great non-surgical technique to perfect or fine-tune noses. It's really good if you have a little dent in your nose or if you have, just a little small depression. We're going to look at Gabby today, and let's have Gabby turn to the side. And if we look here, you can see Gabby has just a little bit of a dent there and a little bit of a dent there. Now, the facial fillers work really well for this. Another situation where I think they work terrific is if you've had a rhinoplasty and you have a little divot from a rhinoplasty. And of course, rhinoplasty just means nose job. And the other situation where I really like to use the fillers in noses is for older people. Because with age, what happens is there's a little bit of soft tissue underneath the skin that starts to disappear as you get older. And so it starts to look like skin on bone or on cartilage. And so it sort of has an aging effect to the nose. In fact, right now I probably have a full vial of filler in my nose because it just helps to soften it, make it look a little bit more youthful. So what we're going to be using today is we're going to be using a really great filler. It's Restylane. And what I like about Restylane is it's naturally occurring in our skin. It's hyaluronic acid, so we have it in our skin, we have it in our eyeballs, and we also have it in our joints. So it's natural, and so we don't really have any reactions to this type of filler. What that means is that your body's not going to reject it. In the old days, we used to use bovine collagen, which was derived from cows, and you could actually have an allergic reaction to that, so we had to do testing before we did it. With this product, one of the reasons I like it is because it doesn't attract a lot of water, which means it's not going to swell very much, number one. And number two, it really stays in place. Juvederm tends to move out a little bit and spread out a little bit. That's why I like it in the hands. But in the nose, we don't really want it to spread around. We want it to really stay in the position where we're looking to place it, if that makes sense. So the treatment is really simple. What we're going to do is, why don't I go on this side here? And we're just going to try to fill in that little crease here. And do I have another syringe just in case we need it? And so we're just putting in little drops. And how are you feeling right now?
Fine.
Okay, great.
No discomfort.
No discomfort? Mm-hmm. And so when I inject, I like to kind of go a little bit slow because we don't want to cause a lot of discomfort. Now, the risks with this are just a little bit of bruising, a little bit of swelling, and there have been a couple reported cases of blindness. Now, that's a very, very, very rare side effect, and I do believe it's from doing large volume injections in one location. So if I just put this needle in one place and just blasted it in, I think we'd have a higher chance of having it cause blindness. I've never even come close to anything like that, so it doesn't scare me too much. So what we're doing is we're just kind of putting in little drops, and then we're looking at the side to make sure that we're getting a nice result. There we go, and we can see it's already starting to straighten out a little bit here. And so for a female, we don't want to really make it a bulky nose. For guys, you can make it bulky and it's an attractive look. But for a woman, you really don't want it to be bulky at all. So now I think she has just a little divot here, so we're going to do a little bit down at the bottom of the nose as well. And you can see we're putting these little drops in. The nice thing about this is this treatment is going to last for probably about 6 months to a year even. There, you can see how nice that's looking. It's looking nice and straight. There we go. And how are you feeling?
Fine.
All right, good. Mm-hmm. Now the filler does have a little bit of lidocaine in it, which means it numbs as we inject as well. There we go. And see, we've got this nice straight looking nose from just a few injections. Now there's just going to be a little bit of swelling, and we save just a little bit, so in a week we can have Gabby back and make sure that she's happy with the way it looks and see if we need to add any more. Because when you do this, there is just a little bit of initial swelling that happens from the injections that will disappear. See how nice and straight that looks? And it's that simple. That took about 5 minutes. So aftercare instruction is really simple. We'll provide a little bit of ice to put on it. And the ice just minimizes the amount of swelling that a person has. So it's a very simple treatment, very easy. If you have any questions about it, please let us know at contourderm.com.